A patient has arrived for a review of his chronic conditions. He has hypertension and used to smoke cigarettes, but has changed to vaping in hopes that it is a healthier choice. How is this coded? A. I10 ZEIGHTI 7.EIGHT191 F17.TWO111 F17.TWO190B I15.NINE U7.ZERO F17.TWO190CI10 F17.TWO190D U7.ONE I10 F17.TWO110 F17.TWO190. A cyclops lesion may result as a complication of which surgery? AACL repair, B. Knee replacement, C. Osteotomy, D. Posterior cruciate ligament reconstruction in the case of a staged revision for infection after a hip replacement, which CPTE code should be used for the second stage of the surgery once the infection has resolved and the new total hip arthroplasty components are implanted. A 27,030B, 27,137C, 27,134D, 27,091. True or false? Healthcare practices should know how to submit a paper claim in case of cyber attacks. A true, B. False. A patient arrived at the ER with shortness of breath. After radiology and other tests, it is determined that she has bronchiolitis obliterans, more popularly known as popcorn lung. The physician directly links this condition to her vaping habit. How is this coded? AU7.ZERO, J44.EIGHTY1, F17.TWO190B, U7.ONE, J44.EIGHTY1, F17.TWO110C, U7.ZERO, J44.EIGHTY1, F17.TWO110D, U7.ONE, J44.EIGHTY1, F17.TW190. A doctor documents cyclops lesion in RT knee status post ACL repair 2 years ago. How is this coded? AM24.SIX161B TEIGHTY4.EIGHT2XAC TEIGHTY4.EIGHT2XA M24.SIX161D M24.SIX161 TEIGHTY4.EIGHT2XA, which is an OT, a best practice for avoiding duplicate claims. A. Use unit of service multipliers instead of multiple line items. B. Resubmit electronic claims that haven't been processed after 2 weeks. C. Monitor and analyze duplicate claim denial trends. D. Coordinate billing between departments in a physician group or health system. Which of the following tips can be used to manage prior authorization denials? A. Keep a list of alternate treat for patients when a service or treatment is denied. B. Subscribe to payer newsletters. C. Keep track of denial reasons and see whether any patterns emerge. D. B and C. A provider performs a major surgery on a Medicare patient and then transfers the remaining postoperative care to the patient's primary care provider PCP. Which modifier should be appended to the postoperative visits performed by the PCP? AFTB 54C 55D 56. When an infection occurs after hip replacement, which CPTE code is used for a procedure where the surgeon performs debridement but no components are exchanged? A. 27,091B, 20,704C, 27,030D, 27,134. Which of the following is an OT and effective way to hone coding quality? A. Offer refresher courses for coders. B. Leverage technology. C. Re-audit after an initial audit and feedback. D. Focus more on coding education and less on education of clinical staff. What is the main goal of a total hip replace? 8. To enlarge a hip joint. B. To relieve hip pain, restore alignment, and improve function. C. To strengthen the muscles around the hip joint. D. To eliminate the need for physical therapy. Beginning in 2025, how is a personal history of non-neoplastic polyps coded? AZ86.TENB, Z83.SEVENTY2C, Z86.ONE100D, Z86.ONE102. Which of the following may be a symptom of colorectal cancer? A. Type 2 diabetes. B. Persistent cough. C. Unexplained weight loss. D. Persistent bronchitis. Which of the following is not a non-neoplastic polyp type? A. Hyperplastic. B. Tubular adenoma. C. Inflammatory. D. Hematomatous. How many post-op days are in the global period for a major surgery? A0B, 10C 30D. 19 practices with 10 or more physicians in Florida, Louisiana, Nevada, New Jersey, North Dakota, Oregon, and Rhode Island Reporting CPT code 99024 is required for all postoperative visits furnished during the global period in which place of service. A. Facility B. Outpatient clinic C. Physician office D. All of the above. Thank you for watching my video. Please like and subscribe.